Hi, everyone. Thank you for joining me. And I hope you had a chance to watch the acupuncture presentation from yesterday. This builds on that. I mean, photomedicine is a different way to stimulate locations on the body. But like with acupuncture, uh, we can target our application of the treatment based on our myofascial palpation and our understanding of the diagnosis and its, etiopathogenesis. And also what's important to me as I teach these courses is helping inform, the participants about better ways to diagnose in addition to what you've already learned. But the myofascial palpation is part of that, and also watching them walk or move. And that's why I've generated a series of handouts. There's how to see a dog, how to see a cat, that's available from our website. And then coming up is how to see a horse. So just more comprehensive ways to see our patients and see how they've maybe compensated and maladapted to different problems that are either somatic or visceral in origin. So today what I'm going to discuss are the top 10 clinical applications of photomedicine from lasers and LEDs. So these are not necessarily cold lasers anymore. They used to be called cold lasers, but now with the class 4 devices, things have gotten pretty hot. And that's why whenever I talk about class 4 laser devices, which I love because I've used them a lot in my human and non-human practices, but I find that the preset parameters are way too high, sometimes by a factor of 4 or more, depending on the species that I'm treating. So that's why I like to include the concept of light emitting diodes, because you can get a whole range of devices with LEDs in them that are designed for therapy. And now they're making different wavelengths of them. And just there's a lot of potential, and there's more opportunity then for clients to use these devices at home and safely, because we don't have the same ocular concerns. But anyway, so just to narrow this down, because I teach long courses and a lot of stuff, I think that I generally include too much information, but I think it's important to be thorough. So we're going to base these clinical applications on the diagnosis and the pathophysiology. So I've just sort of summarized a bunch of them here. There's definitely more. But if we look at problems with the skin, so wounds or irritations, inflammations, non-healing issues, we can have like three main sets. There's postoperative, there's poorly healing, so chronic long-term wounds, and then there's ulcerative conditions. So all of those are really crying out for photobiomodulation, which is the term that describes how photons work to heal tissue. So like we talked about with neuromodulation and connective tissue effects with medical acupuncture, we can talk about photobiomodulation because it's the photon that hits the biological tissue and modulates its physiology. So brings it back into a more normal homeostatic way of functioning. And so with skin, we'll talk about that and different facets of how that works. Musculoskeletal pain, of course, because photomedicine in itself is neuromodulating, so it can help improve nerve function and normalize it. It also, especially with the more warming things, not too hot, but just a nice warmth, comfortable warmth that you don't hold the animal down for and they're crying because it's hurting them because it's causing a thermal burn, but nice warmth helps to relax the tissue and just makes the fascia just more fluid. So that's a common condition. We'll talk about that. And anti-inflammatory effects, because it's actually changing some of the factors, changing the phenotype of certain of macrophages. And I'll talk a little bit about that. But inflammation as a disease process can happen, in all kinds of tissues and parts of the body. So is it in the joint? Is it in the soft tissues? Is it in the oral cavity, like a stomatitis or radiation-induced mucositis, for which there's surprisingly quite a bit of literature on how photobiomodulation improves the state of the head and neck tissues that have received radiation therapy, and that's done mostly in humans. But and usually we want to avoid treating patients with cancer because of the proliferative aspects, regenerative aspects of photomedicine. But but in this condition, I mean, they're already getting treated for the cancer, but I wouldn't ever shine a laser light on a cancer without trying to do photodynamic therapy or, something that is actually proven to not proliferate the tissues. And then there's neurologic disease and injury. So central and peripheral problems, whether it be traumatic brain injury. In humans, it's been looked at a lot with degenerative conditions or, like dementia, and also spinal cord injury, which is very important for us with the small animals. So disc disease, and then peripheral nerve regeneration. So just briefly, and I keep on looking over to my phone because I want to stay in the time parameters, which is why I'll need the full 20 minutes. So if you have questions, I'd prefer you to just email me. You'll see my email at the end, narda@curacore.org. Go to our booth, send me an email, a chat, whatever. So how does photobiomodulation work? So this is a dog in the sunlight, and we can think about plants and photosynthesis. So there's some remarkably similar aspects to it that I won't go into here. But for us, at least a big part of the photobiomodulation central kind of area that light interfaces with tissue is intracellular, and it's in the mitochondria, which is down here at the bottom right. Looks like a piece of cheese or something. So it's a lot about the oxidative phosphorylation pathway. So ultimately, one of the many spectrum of the many spectra of physiologic changes and factors and products that the mitochondria make, part of that is ATP. And that is what is going to help support the activities of daily living, cellular regeneration, division, and produce a bunch of growth factors and different things that we need. So within that oxidative phosphorylation, that electron transport chain that is requiring oxygen to work most efficiently and produce the ATP, we have this enzyme here that looks like ribbon candy. It's just a stock photo from Shutterstock, but it's made to represent the cytochrome C oxidase, this transmembrane enzyme that's within that mitochondrial membrane. And what that does is it has these oxygen binding sites because it's oxidative phosphorylation. And so it works most efficiently when oxygen can bind to that enzyme. And then the system goes on its merry way and ultimately puts out ATP. But here, if you can see my pointer, we have nitric oxide bound to the enzyme, and that is occupying in a reversible fashion the places where oxygen should be binding. And so when we add photons made here by the red arrows, then that is going to cause a dissociation of the nitric oxide so that oxygen can bind there, and then things are back to normal. And we bring this underfunctioning mitochondrion that was kind of sluggish in its ATP generation to a more normal state. And that is what is then going to kickstart the metabolism of the mitochondria and the rest of the organelles and the cells and the tissues that rely on a good healthy dose of growth factors and other just substances of daily living, including ATP. And so when we're talking about skin wounds, this was actually the first patient that I saw during my 20 years of working at CSU as a faculty member, and I just had a little laser pointer like a cat toy, and this bird was self-traumatizing, feather picking, and I just painted on, like we do even with a class 4 device, just shown it at the skin, and it had some remarkable improvements there. I also have the acupuncture needles at stomach 36 there, but it in bird after bird, in patients after patients, it has helped even that low amount of radiation. So that's less than 5 milliwatts, and it's a red light spectrum, but it really accelerated wound growth. And that was just the beginning of my whole, long career then with photobiomodulation at CSU. So there's a number of things that it helps: promotes neovascularization, angiogenesis, increases collagen synthesis, accelerates wound healing, and so on. So we have these 4 different stages. And where can photobiomodulation help? Well, with the inflammatory stage, it's regulating inflammatory cytokines, modulating reactive oxygen species. During the proliferative phase, it's biostimulatory and increases the ATP production, like I've been saying. And then with the matrix metalloproteinase induced remodeling, that's how that wound matures at the end. So there's all these different stages, and photobiomodulation can help with many of them, not so much with the hemostasis because it's going to dilate blood vessels, but after that, it can also help reduce infection to a degree. That still needs a bunch of study though. But anyway, with animal models and all that, just that there's research out there looking at the most beneficial parameters, and they found in the red light or the near infrared, so 600 or 800 nanometer range. But again, causes cellular proliferation, and this was with low level laser for all these different types of cells, the fibroblasts, the keratinocytes, endothelial cells, lymphocytes, increases migration and adhesion molecules, and inhibits apoptosis. So all this is wonderful, but keep in mind that because certain cells respond a great deal to photobiomodulation and the application of light, this is why we're going to be very careful. If there's a known cancer, we don't want to shine the light on it. And I know that some groups, it seems like, are like, oh, it doesn't matter, but it really does matter. And especially with something like melanoma, that loves light. It loves red light. So I would not be accepting any time that we're going to use regular laser therapy on cancer. If an animal has cancer somewhere else in the body, then that's a discussion between you and the client and your knowledge of what's likely to be inadvertently swimming around in the bloodstream. Mast cells respond well, lymphocytes respond well. So again, any type of tumor, we're going to be concerned. But in the non-cancer state, then there's immune improvement. There is again this switching of the phenotype for the macrophages from pro-inflammatory to anti-inflammatory. Additional effects are vasodilatory, like I mentioned, bringing more oxygen to the tissue, which also means bringing more antibiotics or stuff, more immune cells, whatever needs to happen there. You're improving circulation into the area and then out of the area. Diabetic wound healing as well. And this is what brings to light just the science of matrix metalloproteinases and how they help with the tissue remodeling. So each thing has different types of recruits for different phases as it's going, and changing levels of types of gene expression, et cetera. Again, I don't have much time, so I'm kind of whipping through this. Even in infected tissue, this was a guy, and this was our original companion laser back when, I think 2009 at CSU, the first one that I had that was a class 4. And he'd had an amputation. He had Pseudomonas, then methicillin-resistant staph infection in this ulcer that began about this size. I didn't take a picture at the beginning, but then with continued treatment, it reduced, but it never went away. And ultimately, we found out that was because there was some osteomyelitis, and it did not address that. But oftentimes, blue light is the one. Like human dermatologists will use blue light in LED form for acne. And so it does have some anti-infectivity even for this resistant staph, but I think we need to have a lot more information before we rely on it too heavily. I think we can introduce it to our general overall treatment, but I would not say it works as effectively as we need it to be a sole treatment by any means. But think of all the musculoskeletal ailments that you treat, and again, with a not excessive amount of class 4 hot irradiation. They're class 3B or class 4 in a very carefully applied way. When I apply class 4, whether it's a human or non-human, I am using my non-dominant hand after the applicator, and I am feeling the tissue. I am in constant communication, whether it's verbal or nonverbal, with my patient to see how is this, because even on one person, I've seen that they can be very sensitive in their neck and it wasn't sensitive anywhere else. So you get neuropathic nerves that are more sensitive and things like that. Anyway, so being a better diagnostician, hands-on, watching them, good history, where is the problem, what is the nature of pain, and how are we going to address it? Usually we want a multimodal approach, but photomedicine has quite a bit to do on its own. So Mike Hamblin from MIT Wellman Center for Photomedicine, he's like the premier researcher. He's a great guy. He's published a lot. So look for him, Mike Hamblin. But here's an article, Mechanisms and Applications of the Anti-Inflammatory Effects of Photobiomodulation. And so just a lot of different aspects from just the inflammatory factors, cytokines, to the nerve effects, to the circulation, and very few side effects as long as you do it appropriately. The near infrared, the 830 nanometer, which is invisible to our eyes, but has a nice deep penetration of light. So that's one type of just parameter is the wavelength, and I would choose that if I was treating nerve conditions, spinal cord injury, and the like. And it's just very nice, but oftentimes for superficial stuff, you need to pair it with a red light, which is going to stay more on the surface. So lots of different mechanisms, from neurotransmitters and opioidergic, and here's just part of a paragraph: reduction of edema, reduction in markers of oxidative stress and pro-inflammatory cytokines, etc. Even they are looking at some intra kind of abdominal or even cardiac applications for photobiomodulation and oral and diabetes, Alzheimer's disease. I mean, if it's treating inflammation, there's a lot of inflammatory diseases. And so this is Buster and Eddie, who used to come down to Colorado State from South Dakota, and I would treat them one at a time. And this was a screech owl from the Rocky Mountain Raptor Center that I treated for shoulder injury. And just a mention of the safety, that this is one of my other class 4 devices. It was an Apollo laser with a really coned down head, designed for acu laser or something, but I used it for, I mean, you could use it for that, but I treat from a different perspective than just only selecting points for magical regions. I select points because of nerve pathways and muscle pathways, myofascial aspects, fascial constriction, whatever kind of somatovisceral organ relationships. So I might choose a point, but I'm much more interested in the whole anatomical structure. But this coned down 500 milliwatts into one spot, and we could smell the feathers smoking a little bit. So that was too much in one spot. So you really have to know how hot is your laser, how small is the spot size, what are you going to use it on? And so this is for his limb. It's much more diffuse, obviously. So I'd be palpating. This was an illegal laser that was mailed to me from one of my MD friends in Puerto Rico. It's a 50 milliwatt laser light. But anyway, won't go into that. So just, not FDA approved. But it was really good for birds because it was bigger, it was stronger than a laser pointer, but not so strong and diffuse that it went all over the place. Anyhow, so this is a review article for neck pain. So just showing just the summary. If you look at this through the video, you can look more at these, but for neck pain, for dental pain, so different types of pain. And this was a human study, just looking at, did you go extra oral, did you go intraoral, but something to think about for our dental patients, to reduce pain, to facilitate healing, to reduce inflammation, to support, recovery and tissue regrowth. So good for postoperative dental pain and edema. And this work talks about just activating the stem cells, progenitor cells in the tissue for muscle repair. And that's a lot what we do with electroacupuncture. We're working with endogenous stem cells that are improving the recovery rate and the regenerative potential. And then this is just an article free for download on the web on how the many ways in which photobiomodulation impacts the brain, the spinal cord, nerve tissue, increasing the axonal number and distance of regrowth, suppressing inflammation, improving circulation. So really, this kind of approach is so safe when you're doing it within a certain range, and improving motor response in individuals with spinal cord injury. So much potential for healing. And why isn't this just a standard approach for any down dog? This was an early study years ago from University of Florida, where they looked at how well dogs did with a Thor laser device. This is a class 3B. After surgery, I like to do as much as we can to reduce the amount of surgery, whether it's spinal cord injury or suspected cruciate, within reason and with good judgment. But these animals got better faster and they went home faster. They could walk sooner. So why isn't this standard of care, not only for the pain and neurological problem and the inflammation, but for all the other concomitant problems that spinal cord injury brings, that laser therapy, LED therapy, in accompaniment with medical acupuncture related techniques can address, especially the secondary injury phase from spinal cord injury, where you've got a cascade of vascular, cellular, biochemical ailments that produce the long-term morbidity that photobiomodulation and acupuncture, I mean, is really targeted for. And so that combination is just wonderful. And Mike Petty and I put out an article in Trends Magazine a few months ago with cases on the web that improved with this medical acupuncture related techniques approach. This is Jenny Conrad. You saw her yesterday for this, treating a circus bear. This is treating a head injury, gull, spinal cord injury, squirrel. So just in summary, as with acupuncture, massage, and therapeutic exercise, the more we understand about the mechanisms, the more we can tailor our treatments to individual patients and make better use of their time and our time and the dollars that the clients are giving to us. So I do have a course in photomedicine for veterinarians. Technicians, I think, can take it too. It's just a lot of science. Not that you can't understand that, but it's pretty in-depth. Then we have our EMAV for veterinarians where we talk about photomedicine too. So that's the distance learning version or the on-site version, or you can change and add different components for both so you don't miss out on either. We have a rehab course that's integrative and osteopathic in nature, just whole body, not assembly line, very, very patient tailored. And we're opening that for the registration for 21-22 in June. And then you can visit us on our YouTube channel at Curacore Vet. And I have a bunch of free webinars I've recorded. We just put new stuff out there all the time. So as we talked about, you can go to our website. The left side is for humans part, but the right side is where I spend most of my time, which is the vet, and just go in there and look at courses. So thank you for being here again. Really appreciate it. And I'd love to talk to you. So email me at narda@curacore.org. And I'm good.
Thank you, Dr. Nada. I know you had said you wanted questions be directed to your booth, but some of them people were asking about your slides. They want to know if they would be available afterwards.
I could, yeah, I mean, I could put a handout together. I hear there's a way to upload. I don't know. Email me. That's the best way. Email me.
Okay.
And I can give you a PDF.
Okay, great.